When you treat for asthma, the first important step is find where you're going to put a cap on, and where you're going to treat. Okay. So the most important point is right in here. This, when you bend your head, the largest bone and the large bone right here, the point called diaphragm, just a little bit on the side of, like quarter-inch on the side, they called Ding Chuan. This is three point altogether. So you can use one cup to cover them all. Okay. So you put one cup right in here, then you put the other two just on the side of your spine to line up. Then one here, one here, one here. Now I'm going to show you how to use the cupping therapy to treat for asthma. You put a medium-sized cup right in here. Use the gun, pump the air out. You leave it on for 5 to 15 minutes. Then you can put another one on side here, along the spine. Then you can put another one on the other side, along the spine. Okay. Not even, that's okay. So when it takes the air out, you can pull the trigger here. The air will come out. Then pull the trigger, release. Yeah, pull the trigger, will release. And put it here, release. So when you leave 5 to 15 minutes, most likely you're gonna have a mark like this, the bruise. So when you have the bruise, you don't want to perform therapy on the bruise. You need to wait until the bruise is gone to perform next cupping therapy on the same spot. Otherwise, you may potentially have a permanent mark on your skin like this. So you can do it usually once or once every other week, but make sure the bruise is gone. If you want to do the therapy every week, well, the other bruise haven't gone yet, but you can do the therapy between the other bruise. For example, this area, see, don't have the mark, don't have the bruise. You can perform cupping therapy in here. Okay. Or you can do like right in here, between here don't have bruise, you can put cupping right in here. So in August, when it's really hot in August, you can leave it longer. You can leave the cupping like longer than 15 minutes. It can even create blisters. The pressure for someone have severe case of asthma. In Chinese medicine, we call the blister therapy. We'll leave the cupping long enough to have blister. When you have blister, you do it every other week. Make sure the blister is healed. Then do it again. Usually 3 times in the middle of the summer, around the August. When you have a head cold, you can also use this therapy. You only do it like a few times, like 2 or 3 times. You can do it once a day. If you don't leave bruise on, if you don't leave long enough to cause bruise, you can perform every day. Also, you can use the same therapy to treat for the cough as well. This therapy like this is good for all kinds of respiratory diseases. It is simple and it is very effective. Try it.